My name is Sabrina Pacheco, and today I will be talking about my informative speech, which has to go over hypertrophic cardiomyopathy. It is the most common heritable cardiomyopathy, manifesting as a left ventricular hypertrophy in the absence of secondary cause. So in hypertrophic cardiomyopathy, I wish I had props. Part of the heart becomes thickened without obvious cause. The heart is less able to pump blood throughout the body effectively. Symptoms include shortness of breath, feeling tired, your legs are swollen. It can also present as heart failure and sudden cardiac death. The goal of therapeutic interventions is to reduce dynamic obstruction. Small amounts of patients will experience sudden cardiac death. So, I had a patient known as patient A. He is a 58-year-old male, blood pressure 140/95. I would say pretty normal, but a bit higher than it should be. Resting blood pressure is like 120/80. His is 140/95, so it is a bit high. His resting pulse is 54. Once again, normal, in the normal range, but a bit low. Normal resting pulse 50 to 100, so his is 54. He is close to becoming bradycardic. My patient said he exercised regularly and he is currently training for a marathon. His mother died of articular occlusion at age 48, and his father died of unknown causes at age 52. So when going over my patient's info, I immediately thought that his condition has to be family inherited, especially because of the mothers. So I went ahead and diagnosed my patient with hypertrophic cardiomyopathy. He did mention he was training for a marathon, so participation in competitive sports is highly discouraged by guidelines with this disease. Avoidance of excess alcohol, stimulant consumptions, dehydration, and temperature extremes such as saunas and hot tubs are recommended that you avoid these. Septal myectomy is the most well-established invasive therapy in hypertrophic cardiomyopathy, but still large gaps remain in understanding the cause of this disease, and many others with phenotypic manifestations are left without identified genetic mechanisms. So people may not always get the answers that they want, or the ones that they want to find. So thank you for listening to my informative speech over hypertrophic cardiomyopathy.